From chemotherapy to the end, what we must understand about cancer treatment. At 62, James Walker from Ohio was told he had liver cancer. The diagnosis was devastating, but he and his family were determined to fight. They followed the doctor's plan without hesitation. Chemotherapy, round after round. He endured 6 grueling sessions. His hair fell out. He couldn't keep food down. His skin turned gray and waxy, and he became a shell of the man he once was, an outgoing grandfather who loved weekend cookouts and watching his grandkids play baseball in the yard. After months of suffering, when James could barely stand, a different doctor sat the family down. With a gentle tone and a furrowed brow, he said something that pierced like a dagger. This type of cancer, chemotherapy, doesn't really help much here. His daughter, Susan, was stunned. His wife broke into tears. That one sentence changed everything and left them wondering, why did we put him through this if it wasn't necessary? This isn't a rare story. Across the country, too many families are facing similar situations, jumping straight into chemotherapy without a full understanding of its benefits, risks, and most importantly, whether it's even the right tool for the job. I just want to see my grandson get married. That's what Robert Miller, a 50-year-old truck driver from Kansas City, told his oncologist after being diagnosed with advanced squamous cell lung cancer. Robert had smoked a pack of cigarettes every day for over 20 years. A routine workplace physical revealed a shadow in his right lung. Further testing confirmed the worst. The first instinct? Chemotherapy. Doctors recommended starting immediately. Robert and his wife were hopeful. If I can just push through this, I'll get more time, he said. He wanted time to fix up his old Chevy truck. Time to fish at the lake with his grandson. Time for one more road trip with his wife, Linda. He believed in the treatment. In fact, he was determined to beat the odds. But within weeks of starting chemo, the reality hit hard. His hair thinned rapidly. The nausea never let up. He lost nearly 40 pounds in 3 months. Simple things, walking from the bedroom to the kitchen, left him breathless. The worst part? After nearly a year of enduring the brutal cycle, his scan showed the cancer had spread further, now in his bones and liver. He died shortly after. Linda sat by his bed and whispered, maybe if we hadn't done this, maybe he'd have had more good months, or at least fewer painful ones. Chemotherapy, a double-edged sword. Let's break down what chemotherapy is and what it isn't. Chemotherapy is a systemic treatment that uses powerful drugs to kill or slow the growth of cancer cells. These drugs can be administered through various methods, orally, intravenously, subcutaneously, or even directly into the spinal canal. They travel through the bloodstream, attacking cancer cells wherever they are in the body. There are 2 primary categories. 1, nonspecific chemo drugs. These drugs don't differentiate well between cancer cells and healthy cells. They're like a flood that washes away the bad, but also the good. Think alkylating agents or anti-tumor antibiotics. They disrupt the DNA or RNA in all rapidly dividing cells. That includes cancer, but also hair follicles, bone marrow, and the lining of the stomach. That's why patients often experience, hair loss, nausea and vomiting, appetite loss, diarrhea, liver or kidney toxicity, heart complications, lung fibrosis, neuropathy, burning, tingling, or numbness in the hands and feet, immune suppression, which makes infections much more likely. Particularly for lung cancer patients, even a minor infection can spiral into pneumonia or sepsis, often fatal complications. 2. Targeted drugs and hormone therapies. These are more precise. Some go after specific genetic mutations, like the one seen in certain breast or prostate cancers. Others block hormone receptors. The side effects are usually milder, but not absent. Hormone therapy, for example, can lead to moon face, weight gain, bone density loss, increased risk of blood clots and diabetes. Even targeted drugs may still cause severe fatigue, rashes, or gastrointestinal problems. Why are multiple drugs often used? Cancer is clever. It mutates. It resists. That's why doctors often use combination chemotherapy, multiple drugs at once or in carefully timed sequences. This cocktail approach can be more effective in some cases, but it also means side effects pile up faster. The physical burden on older adults especially can be overwhelming. And here's something few say outright. Doctors must monitor everything: white blood cell counts, liver enzymes, heart rate during chemo. One small shift can mean life-threatening complications. It's not just a treatment. It's a gamble. Why doesn't chemotherapy work for everyone? This is a hard truth. Not everyone benefits from chemotherapy, and sometimes it makes things worse. There are several reasons. Gene mutations in cancer cells may make them resistant to the drug. Some people's bodies metabolize the drug too quickly. It's flushed out before it can work. Poor overall health or organ function can mean the patient just can't tolerate the treatment. In some cases, the cancer is too aggressive and no current treatment is strong enough to stop it. The result? The cancer progresses rapidly. The body is weakened not just by the disease, but by the very treatment meant to help. This is why chemotherapy is not, and should never be, the default for every cancer. It must be tailored, it must be thoughtful, and it must be questioned. So, should we just skip chemotherapy? No, that's not the answer either. Chemotherapy has saved lives. In cases of testicular cancer, some lymphomas, certain types of leukemia, it has achieved long-term remissions and even cures. But the key is matching the right treatment to the right patient at the right time. That means second opinions. It means asking hard questions. And it means doctors being honest about risks versus potential benefits. The tragedy lies in applying a one-size-fits-all solution to a disease that is anything but uniform. Why do cancer patients decline so quickly? According to the World Health Organization, over 10 million people worldwide died from cancer in 2020. Several reasons explain this high mortality. 1. Subtle early symptoms. Many cancers have vague early signs, fatigue, minor pain, occasional bleeding, that get dismissed. By the time significant symptoms like weight loss, chronic pain, or palpable lumps appear, it's often too late for curative treatment. 2. Highly aggressive cancers. Pancreatic cancer, anaplastic thyroid carcinoma, some sarcomas. These are notorious for being fast-growing, stealthy, and resistant to chemotherapy. Even aggressive treatment often adds only weeks or months, not years. 3. Critical organ impact. Cancer growing near the spine, brain, or heart can cause sudden, fatal complications. Tumors in the brain can lead to swelling and death within days. Growths near the lungs or major blood vessels can lead to strokes, paralysis, or heart failure. 4. Immune collapse from treatment. Chemotherapy suppresses bone marrow, which produces white blood cells. That means infections, especially in the lungs, are common and deadly. Sepsis, pneumonia, and multi-organ failure are often the final straw. 5. Cancer hijacks the body's energy. Tumors feed off glucose and nutrients, stealing them from healthy tissues. They can metastasize to the liver, bones, and kidneys, causing anemia, severe fatigue, and eventually total systemic breakdown. So what can we do? 1. Ask questions early. Don't rush into treatment. Get a second opinion. Ask, is chemo likely to improve survival? And what is the quality of life during treatment? 2. Think in terms of balance. Sometimes, the best option is not the most aggressive one. Sometimes, choosing comfort, dignity, and meaningful time with loved ones is the braver and wiser choice. 3. Demand personalized care. Cancer is never just a medical condition. It's emotional, spiritual, and deeply individual. Treatment must reflect that. A final word. James Walker wanted to live. Robert Miller wanted more time. Both were good men, fathers, husbands, grandfathers. They did what they thought was right. But as we move forward, especially as older adults navigating the American healthcare system, we must remember it's okay to question. It's okay to pause. It's okay to choose quality over quantity. Chemotherapy is not the enemy. Blindly trusting it without clear benefit is. Let's fight smarter. Let's live better. And let's never stop asking, is this truly the best path for me?